Good morning, everyone.
Good morning.
We do our best to get started on time, and we're really grateful for all of you to be here today. We mentioned yesterday, and we want to mention today that what we want to do with this workshop is to really have our panels be brief so that we have an opportunity to engage all the brains in the room and really get into a good conversation of what's needed in how do we move evidence-based practice into communities. And of course, no panel will be more important than this one that talks about listening to communities. And yesterday we had an opportunity to listen a great deal, and because there was such an opportunity for the audience to speak, we heard a message that we hadn't heard before. And that message was that we have to pay much more attention to the social determinants of health. And so all of us have been very focused throughout the forum, the life of the forum, we have these 60 or so evidence-based practices that are family-focused and evidence-based, and how do we move them into communities? And what I heard some of the members of the audience say is, you're rearranging the chairs in the deck of the Titanic. We're missing the big picture. And so I think one of the challenges that we will have today, and maybe even in the breakout groups, even though they're not quite designed that way, is to say, how do we integrate the direction in which we have been going, which is moving evidence-based practice into communities, and particularly in this workshop, creating this true partnership between researchers and communities. How do we integrate that with a message that we also have to be attentive to how we address the social context? And we heard a number of examples. Kelly Kelleher gave a number of examples yesterday of how they have been very creative in using Medicaid funds to address housing issues and many other issues that are social determinants issues, and in a patient-by-patient or family-by-family basis. But is there a way in which we could start to think about addressing social determinants in a broader context? And so that's the message that I came away with yesterday and that I want to leave you with. And so that we can get started quickly, I'd like to ask Leslie Walker, my fearless co-chair, to tell us about this workshop and the rest of the day. Thank you.
Good morning, everybody. Glad you're all here. This is great. I too want to welcome you today. I'm really looking forward to how we begin to integrate some of the new things that we have really heard yesterday, new to many of us, and how we, with this next group, how do we really fully integrate the community's needs and wants? How do we, one of the things that's always been interesting to me is we say, researchers and research need to work with the community, and I don't see that they're separate, and they shouldn't be separate. The community and the researchers should all be together. We should all be a part of the communities in which we live, work, and try to move forward and help. So to me, one of the other challenges is how do we begin to break down this artificial separation of researchers and community, and how are we going to build in a different way and do things differently than we have, so that we come out with better outcomes with our young people and help them to thriving in a way that we have not done yet. So, really to help kick that off, we're going to have a panel today, and I'll introduce our moderator in a minute. Right after the panel, however, I'll come back and talk a little more in detail about the breakout groups we're going to have. These are very critical to the forum, because what we want to happen is after you have gone to the breakout group you have chosen, we're very much hoping that you will come out with 2 recommendations to help move and change this, move the field forward and help really change things. And so as you're sitting and you're thinking about and mulling over what we talked about yesterday and in this panel, begin to think about, what are some key things that we could do, broad, far-reaching things that we could do to really change this field and galvanize us to a different place. And for those of you who have not picked a group, there are 3 groups. I'll talk about it a little more later, but those of you that have not picked a group, please look over the 3 groups and pay special attention to the sustainability group, because we would like to have a large number of people in that group as well. Right now, it's a little bit less than the other 2. So if you have any interest at all, which I think it's very interesting, how can we fund and sustain these programs, please think about joining that group today. But right now, why don't we get started with Panel 5, being responsive to communities and implementing evidence-based programs. What do communities need and what do they want? And I want to introduce Alexa Eggleston, who leads implementation of the Conrad N. Hilton Foundation's Youth Substance Use Prevention and Early Intervention Initiative. Previously, she served for 3 years as Substance Abuse Program Director with the Council of State Governments Justice Center in Bethesda, Maryland, where she was responsible for advising governmental and non-governmental agencies on developing and implementing substance abuse treatment and other rehabilitative services for individuals in the criminal justice system. She's also worked as a Director of Public Policy for the National Council of Behavioral Health, where she conducted public policy activities to increase access to substance abuse prevention, treatment, and recovery. She also spent some years as the Director of National Policy for the Legal Action Center, where she directed policy and government relation activities to improve laws, policies, and policies that affect people with histories of addiction. So she's really spent quite a lot of time really trying to help our country and with prevention and treatment of substance use. And I'm sure she'll have a lot to impart as well as be a great moderator. So thank you.